people without insomnia, it turns out, wake up between 10 and 40 times a night. There's the myth that we all need 8 hours of sleep. So I don't know where these numbers are coming from. We get over 90% success. This treatment does improve mood significantly to the degree that they're recommending it as a treatment for depression, actually.
Welcome back to the Personal Trainers Who Care podcast. I'm Vanya from Freeform Fitness. Each episode, I interview one of our trainers, clients, or another health professional in order to teach you the simplest tools to help you live your life just a little bit better. In today's episode, I interview Dr. Lynn, founder of the Insomnia Care Clinic here in Ottawa. Dr. Lynn is a medical general practitioner who has specialized in the psychotherapy field for the past 32 years. Over the last 7 years, he's focused his practice on treating chronic insomnia using cognitive behavioral therapy for insomnia. He's treated over 4,000 people to date for insomnia, and he has recently been joined by 2 other doctors in his clinic. Dr. Irina Lepadatu and Dr. Marie-Claude Gagnon has joined him in providing treatment for chronic insomnia at the Insomnia Care Clinic.
Thanks again for joining me in today's discussion on sleep, insomnia, and how to help our viewers improve their sleep habits. Now, I know that with all the information that's available out there about various health topics, there can be quite a lot of misinformation as well. So I know that a big part of your program that you do with your patients is to teach them about some of these myths and misconceptions about sleep. So can you go over some of these common misconceptions that you hear about?
Oh, thank you, Vanya. That's a great question. And we do teach people a lot of information about sleep that they're surprised by. So probably one that helps a lot of people is to know that it's quite normal to wake up during the night. And people without insomnia, it turns out, wake up between 10 and 40 times a night, but only for less than 15 seconds. And they won't even remember it in the morning, because to somebody without insomnia, it's a non-event. And so a lot of people will say, oh, I wake up, Dr. Lynn, 5 times a night, 10 times a night. My sleep is fragmented. They'll use that term because they've read it somewhere. And then they think this is a disaster and that it's therefore not good sleep. And no wonder they don't feel rested in the morning. When in fact, waking up in the middle of the night is quite normal. And the fact that you wake up does not impair the quality of the restedness during the day, actually. Mm-hmm. Unless you get stressed by it. And that's the thing. People with insomnia will get stressed and they'll go, oh, I'm awake again. What's wrong with me? And of course, when they have that kind of thinking going on, they get higher adrenaline and cortisol levels because the stress system gets activated, and that wakes you up. So then they're fully awake. And sure enough, they're awake for long periods of time, which is a major part of the suffering of insomnia.
Right. Well,
that's one of the myths, but there's many other ones. If you'd like to hear, I don't know.
Yeah, for sure.
So for instance, there's the myth that we all need 8 hours of sleep. Mm-hmm. And it turns out that that's not true either. That it's, I compare it to foot size. We don't say to people, oh, you're not a size 8 foot. That's a problem. Because, and if you had somebody with a size 6 foot or sleeping 6 hours, they'll never have a size 8 foot. Doesn't matter how much they want it or try to. And it's the same with people's sleep. It varies between 6 to 8 hours per night. And if you're a person who only needs 6 hours and that's actually the right amount for you, it's not going to be possible for you to get 8, and it's not a reasonable or necessary goal to try to achieve 8 hours of sleep. Mm-hmm. So that is another myth that's out there that's somebody just made up at some point, and it became part of our sort of common idea of what is the truth, but it's not.
Right.
So.
Interesting. do you have an idea of where that magical, 8 hours even came from?
I don't. A lot of the major sleep organizations are still putting committees together to make recommendations for the amount of sleep that adults should get every night. And they come up with 8 to 9 hours. And I have looked at the research that they quote as their backup for that. And that's not what it says in that research.
Okay.
So I don't know where these numbers are coming from. It's an odd thing. I read another author who noticed the same thing that I did. And he said that he thought maybe they were just trying to err on the side of caution to make sure people were getting enough sleep. But it actually causes stress and it causes insomnia for people to have those false ideas.
Yeah. Okay. Interesting. Yeah.
So I help.
Well, it sounds like, just based off of your first two myths, insomnia sounds like more of a stress issue than a lack of sleep issue, because people have these expectations of what their sleep is supposed to look like, or how much rest they need or is required for them to be able to function, but that ends up kind of working against them, it sounds like.
Exactly, yeah. And it's people with insomnia are not all stressed, actually, or not all of them have high anxiety levels. A lot of them do. But some people don't have that stress, but they often do have this stressful thinking going on about their sleep, which causes them not to sleep. Because the stress system, as I said before, the adrenaline goes up and they're alert and awake. But there's something very interesting. Some people don't have high anxiety levels. They'll be a very calm person, but they're alert. They're really alert. And in the day, but also during the night. And a lot of people with insomnia will describe that by saying, I'm tired, but I'm wired, so I can't sleep. And it's one of the theories about insomnia, which I find to be a very good explanation of what's going on in most people with insomnia, is that we call it hyperarousal. They're excessively alert when they wake up in the night. So, for example, people will tell me, Dr. Lynn, I go to bed and I fall asleep at 11, and then I wake up at midnight and I feel like I've slept all night because they're alert.
Yeah.
And they'll look at the clock and they'll go, what? It's only midnight? And it's the same branch of the nervous system that causes anxiety in some people that causes hyperarousal or excessive alertness in other people. So we do a lot of things in the program to bring down that excessive alertness and help people to sleep.
What kind of techniques do you use to do that and decrease people's hyperarousal?
So there's several things that we do to bring the hyperarousal down. One of them is we find that in people with insomnia, the sympathetic division of the nervous system is overactive. And that's the part of the nervous system that does things like raise your heart rate when you stand up and walk around the room. But it also is responsible for what's called the stress response, or the fight or flight. You've probably heard of that.
Yeah.
And so it has elevated activity and reactivity in people with insomnia. And there's another branch of the nervous system called the parasympathetic division. And it will lower your heart rate when you sit back down after walking around. And it also causes what's called the relaxation response, as opposed to the stress response. And a lot of people are not aware of this branch of the nervous system, but it has low activity in people with insomnia. So high activity of the sympathetic stress system, low activity of the parasympathetic relaxation system. What we do is I give them relaxation exercises to practice that will strengthen the relaxation system, and it brings down the activity of the stress system. And that's one of the things that really has a big impact on, first of all, anxiety in people who are anxious, but also this hyperarousal or excessive alertness in people with insomnia. Yeah. So That's one thing we do. There's some other things that we do as well that I can talk about that when we talk about, for example, sleep scheduling.
Okay. Yeah. Yeah. Before we go into that, before you mentioned that a large portion of the patients you see do have that high stress levels and anxiety about sleep that causes their insomnia, but there's a segment of your patients that don't have that.
Yes.
So what generally causes them to experience insomnia if it's not stress or anxiety?
Well, it usually is the hyperarousal as one of the components. It's complicated, actually. It's the way they're thinking about their sleep to start off with. So I've given you a couple of examples of myths that are out there about sleep. Another myth is that not getting enough sleep, or people with insomnia have a terrible risk for all sorts of diseases. But in fact, that's not what the research shows. It doesn't show that people with insomnia are at higher risk, because the amount of sleep they're getting, at that amount of sleep, we don't have evidence that it causes health problems, significant health problems. Having said that, I should correct that and say that it does contribute to mental health problems like depression and anxiety, and also to stress levels, which in the long run actually does cause or contribute to physical health problems. But that's another myth that they have. So some of the people, it's complicated. When you ask me that question, I can't give you an answer for any given individual. And in fact, I usually don't know for any given individual until they're in the program and I start observing what's happening with their sleep and how they're talking about it and what is getting to them. What's causing their insomnia by taking them through the program. So there's the thinking problems, there's scheduling problems. A lot of people with insomnia will do things like sleep in to try to catch up on their sleep that they're not getting enough of. And when you sleep in, what it does is it disrupts the circadian rhythm. Now, the circadian rhythm is a system that's built into us, which promotes sleepiness at night, at bedtime, and throughout the night, and then wakefulness and energy during the day. But you've probably noticed yourself, Anya, that when we go through the daylight savings time shift, that most people are having trouble for about a week. Even people without insomnia will complain, I can't sleep, or I'm having trouble with my sleep, or my mood's off, or my stomach hurts, or all sorts of things. And so it turns out that even just a 1 hour shift in the get up time causes jet lag, actually. It's the same thing as jet lag. And that causes insomnia. It's a big contributing factor to insomnia. So one thing we do is we get people onto a regular schedule, and there's a way of doing that that works for each individual. It takes some analysis of what's going on with their sleep in order to figure out the right get up time. And we also, so by doing that and getting people to get up at the same time every morning and to go to bed at approximately the same time every night, their circadian rhythm starts to be there for them so that they're sleepy at bedtime, and when they get up in the morning, their circadian rhythm has done a whole bunch of things biologically to promote wakefulness and alertness and restedness. So that's a big part of what we do. We also, so, we're talking about the different things that cause insomnia. As I say, it's a complicated question, and I think I'd rather answer it as I go through the different parts of the program. Otherwise, I'm talking about all of the parts of the program at once.
Yeah, for sure. Yeah. And, how I got introduced to you and your program in the first place is through one of my clients who went through your program back in the fall. And she was raving to me about how life-changing it has been for her to go through your program, because she's been able to kind of finally, sleep well after suffering from insomnia after all these years. And one of the things she mentioned learning was that, everybody kind of has their own sort of sleep schedule, right? Some people are more night owls, so it's okay for them to sleep a little bit later and kind of wake up during their natural sort of circadian rhythm. And she was telling me about how her and her partner have very different sleep schedules. So it was learning that it was okay for them to not have to go to bed and wake up at the same time. That was a big, one of the big changing factors for her. And it's the same for me and my husband. I'm more of a morning person. I have to get up before 5 a.m. since I start training clients at 6, whereas he doesn't have to do that. So, and he's more of a night owl, so he's able to kind of like sleep a little later. And yeah, I think that's, kind of like figuring out what works for you, I guess, is one of the big takeaways.
That's absolutely right. And I help people, and the other doctors in the program, we all help people to figure out how much sleep they need and the sweet spot for their sleep scheduling, because it turns out it's called the chronotype, and the night owl and the morning lark are the sort of extreme examples of chronotypes. But again, comparing it to foot size or shoe size, there's just so many different shoe sizes, aren't there, and foot sizes. And some people have big feet and some people have small, but most of us are clustered around some average. So most people, it turns out, are somewhere around 11 till 7 or something like that would be the sweet spot for their sleep. However, for one person, it's 11. I just experienced that the other day in one of my groups. Someone said, I tried to get up at 7:15 and I just felt off, and I did it for the whole week. And then I went back to 7 o'clock, and what a difference.
Yeah.
So it can be that small a difference. And it's like shoes. If you get the wrong size of shoes, if they're just a little too narrow in the toe, well, your feet hurt, right? And then you get this slightly bigger size, and there we go, we're good. So it's trying to find the right fit for the chronotype for each of the participants in the program is one thing that we do, and it has a big effect for sure.
Yeah. Yeah, and earlier you mentioned, issues with depression and anxiety, and another thing that my client mentioned learning was that for most people, I think she said around 5.5 to 6 hours of sleep was enough for you to, do well cognitively, I guess, in order to perform well in your day-to-day activities, and any more in terms of benefit would be for your overall mood and mental health, I guess. Is that correct in saying?
Yeah, there's lots of research that shows that if you get 5.5 hours of sleep, they call it core sleep, and they've done all sorts of testing on people when they're only getting 5.5 hours of sleep, and their cognitive functioning is normal, so that they can do mental tasks. If your job involves computer programming, you can focus your attention, and you can add and subtract and remember code and do all that sort of stuff, for example. However, you might be in a lousy mood, and you might feel tired while you're doing it. And so for most people, 5.5, in fact, for the majority of people, 5.5 hours is inadequate sleep to feel good during the day, but you can function. And that's nice for people to know, because if they had a bad night and they go, oh, wait a minute, I've got 5.75 hours, at least I'll be able to do my job today. It really does help them to get through their day. And actually, stress impairs cognitive functioning quite severely and very rapidly. And so if they're stressed about their ability to function cognitively, well, then they're not going to function well cognitively. And then people will tend to blame it on their sleep instead of on the stress. And so, so it can be very helpful to people to know that.
Yeah, it definitely sounds like stress, and just that, having all these misconceptions about sleep plays a huge role. So hopefully this information can help some people at least, not feel so stressed out about their situation, and that, they're probably not as bad as they think they are in terms of how their sleep is affecting them.
Well, it's interesting too, because you're absolutely right. There's another myth, or there's another misconception that people have, which is their own estimation of how much sleep they're getting. And the research shows that people with insomnia are underestimating the sleep they're getting by 1 hour on average. So a lot of people will think they're only getting 5 hours of sleep when in fact they're getting 6. And we see that in the sleep logs. People on their first sleep log will go, I was so surprised that I was on average getting 6 hours of sleep when I originally thought I was only getting 5. Mm-hmm. And I think it's an honest mistake. And it's part of it is because when they're awake, time drags in the night, right? When you're awake. And so they overestimate the time they're awake, which subtracts from their estimate of the time that they've slept, right? Mm-hmm. And the other thing is there's something called stage 2 light sleep, which is 50% of the night. And a lot of people with insomnia, because of the hyperarousal, they're more alert during the night. So they're more aware of light sleep. Mm-hmm. And stage 2 light sleep, we are thinking throughout stage 2 light sleep. We're actually problem solving in our sleep. And so people will notice that they're thinking, and they'll also notice things in the environment, and they'll notice their body more during light sleep. And they think that they're awake. And this is a fairly common problem. There's actually a disorder which has to do with some people are misperceiving that stage of sleep as being awake. And so they think they don't sleep at all. Mm-hmm. And in fact, they are sleeping. So for most people with insomnia, they're mistaking that stage of sleep for being awake. And so then they underestimate the amount of sleep they're getting. Yeah, it's a very interesting thing. Yeah. You might notice that in the morning before you get up. I don't know if you have insomnia, but in the morning when you're rested, that last period of sleep, do you notice that you're thinking about things? You might be thinking about your day, very practical stuff.
Mm-hmm. Yeah, and I get that way too. I'm not necessarily sure if I was actually sleeping or awake, because it kind of feels a little like both.
That's stage 2 sleep, and that's exactly what happens is people are not sure. Mm-hmm. Right. So one of the things I do to ask people to distinguish between that and being awake, I ask them, are you awake right now? And they smile at me and they go, of course I am. And they nod their head, right? And I go, see how confident you are? But you just said you're not sure if you're awake or asleep at that time. And that demonstrates, you're awake now. So it demonstrates to me that you're asleep. Actually, you're in stage 2 sleep there. Because it's confusing.
Yeah. Oh, yeah.
Yeah.
And so we've gone over, several myths. So once you meet with your patients, like how does that whole process work? What does your treatment look like?
Okay, so, well, first of all, the patients need to have a referral from a physician in order to get into the program, because we're doctors and we're paid by OHIP, and that's the requirement. Mm-hmm. And so we get them to fill out a questionnaire, and we get a referral from the doctor, and we do an assessment of their problem, and then we talk to them about, whether or not they have insomnia and it's appropriate for them to be in the program or not. And we also tell them what benefits we think they'll probably get. So that's an intake appointment. It takes usually half an hour to an hour, depending on the patient. An hour and 15 minutes sometimes if it's an elderly person with a lot of medical conditions or complicated issues. And then they have the program explained to them. And what it is it's 6 sessions done in a group. And I always tell people it's not a share your problems type of group. And most people they look relieved when I tell them that. Because they've been watching group therapy on television and they're worried that it's going to be something like that.
Right. Yeah.
And, they're like, no, I don't want to do that. So it's more like a workshop actually format. And the 6 sessions are spread out over 8 weeks. So they're once a week for the first 3, and then once every 2 weeks for the remaining 3 sessions. And we meet there long, actually. They're 3 hours and 15 minutes. And they either start at 9:30 or 3 o'clock in the afternoon, depending on the group that you join. And so what they do is the patients show up as a group. There's usually 12 to 14 people. And I teach, I review, or one of the other physicians does, what we've learned in past sessions. And then we also talk to each patient individually about their sleep log. So we get them keeping a log every morning. It takes about a minute to fill out 6 numbers. And then we can see the pattern of their sleep, and we can see whether it's improving or not improving. So for example, if somebody comes in with onset insomnia, meaning that they have trouble falling asleep at the beginning of the night, and it's taking them an hour on average to fall asleep, then we want to see that shrink down to less than half an hour to be normal. And if it's not doing so, then we'll adjust the schedule, or I'll suggest they do certain techniques to help them with that. Depending on what's going on. So I'll talk with each person individually, and I do that in front of the group. But we don't talk about anything we know about people that's from our intake. So we don't go near any of their medical conditions or their family life or whatever we learn about. We just talk about the sleep log with them and give them practical advice about what's the best thing to do now to continue to improve their sleep. And I believe that that's one of the reasons we get such high success rates, because everybody gets that individual coaching, is what I call it. And it is like coaching. It's like, an athletic team, for example, the coach will talk to each player in front of the group, and, he's showing them how to hold the stick that they use in their sport or whatever. And everyone's going, oh, wait a minute, I'm holding it wrong too. So people learn when I'm talking to one patient, they learn and apply it to themselves. There's lots of questioning back and forth. So most of the conversations are between me and different patients, and it's this back and forth thing that I encourage. I have slideshows. I try to make it funny, so we have some good laughs when we go through it, and it works.
Mm-hmm. Yeah, that was an aspect my client mentioned was very helpful as well. Just hearing that interaction between you and the other patients, and learning from what other people were experiencing as well.
Yeah. And that's where the analysis of what the problem is with their sleep emerges, is when I'm talking to people individually with their sleep log, and over the weeks we can see what's going on that way. I often tell people that in the first session. They say, what should I do? And I go, I'm not sure yet which parts of the program are going to be the most beneficial for you, because I don't actually know at this point. I don't have enough information. But if you do the sleep logs, I'll get that information, and it works quite well.
Mm-hmm. Yeah, that's very similar actually to our approach when we're working with our clients. Because everybody's different, right? There's not going to be one set path that works for everybody. So for us, we really need to build that relationship and learn as much as we can about our clients to know exactly what sort of process to take.
Yeah, exactly. Yeah. And you have to listen with empathy to hear to get people to tell you what's really going on, right? And to encourage them to talk, and you do that and you find out what's really going on, then you can go, I think I know what you need to do now. And
and I actually like the group format, because I find that sometimes some people may not be able to articulate exactly what may be going wrong with them. So having another person verbalize it, and they can be like, oh yes, that's exactly what I'm going through as well. So I can see that being really helpful.
It is, yeah, exactly. Or somebody will ask me a question that was not quite formulated in someone's mind, but they'll go, oh yeah, that's a good question, right? And then I'll answer it, and then they might pipe in at that point and say, I have another question about that. So it's really good. Yeah,
nice. All right. And so you mentioned it's covered by OHIP, so it doesn't cost anybody anything, which is always nice.
Yes.
And so why don't you tell, go over sort of like, what the typical patient looks like when they first come to see you. What do their sleep habits look like? And after going through your program, what kind of results do they generally get?
Okay, so I'm gonna without using anybody's name, I think I'm just gonna open up a chart here, and let me see here. Here's a pretty typical example, actually. Yeah. So this person came in and they had onset insomnia, which is difficulty falling asleep at the beginning of the night. The other type of insomnia is maintenance insomnia, which is waking in the night and being awake for a long time, having a hard time getting back to sleep. So this person had onset insomnia, and they were on actually 2 sleep medications, one that they took every night, and the other one that they took 1 to 4 times per month. And so they were experiencing a lot of anxiety and actually a depressed mood and severe fatigue at the beginning when I first did my intake. Now they went through the program, and by the end of it, they were sleeping half an hour more, which for them wasn't quite enough sleep yet by the end of the program, but we've shown them how to add time to their schedule very gradually to increase the amount of sleep, and it works. So this person would have been well on their way to getting enough sleep by the end of the program. They went from 63% of the time that they were in bed sleeping to 86%, which is normal. Anything above 80 to 85% is normal. And the time to fall asleep went from 2.25 hours down to less than 3/4 of an hour. So it was almost normal. And it's just a question of them continuing to implement what they've learned in the program for several more weeks, and they'll get to their goal of less than half an hour. It turns out that they actually did have some maintenance insomnia of over an hour, and it went down to about 12 minutes, which is completely normal. And then we have a something called the Insomnia Severity Index, which measures insomnia, and it went from 17 down to 3 on that scale, and 7 or less is no insomnia. So they went into the no insomnia zone. Their anxiety went from a moderate of 12 on this scale down to 5, which is mild. Their mood scale score went from 18, which is moderately severe, which is considered depression, down to 7, which is mild. And the fatigue scale went from severe fatigue at 23 on the Flinders fatigue scale down to 11, which is not significant fatigue.
Right.
So you can see that everything improved significantly. And even though the results are still slightly abnormal, what the research shows is that people, if you follow them up a year after they've finished a program like that, 90% of them have continued to improve, actually.
Okay.
Yeah. So I'm very confident that this person, by continuing to implement what they've learned, if we just follow the graph, the insomnia is going down and the sleep's going up, and the fatigue will continue to go down, although it's already in the not significant range. And that's sort of a typical kind of result that we get. And the person is usually telling me that they're feeling much better.
Now, do you do much follow-up with your patients after they completed your program?
What I do is I don't typically know, because most people don't need it. I do tell people if they do need a tune-up appointment with us, that they can send us an email and ask for one, and bring a sleep log, and then I'll give them advice, or we will give them advice. But I find that not very many people need that, actually. It's actually fairly rare, and I will be there to help people if they need help. But most of the time you don't need it, because it just keeps getting better.
Right. Well, yeah, that's definitely a good sign.
Yeah.
You know, what does this do for people, having their sleep be drastically improved?
Well, so for instance, as you saw there, it improves the mood for virtually everyone, including pulling people who are depressed right out of their depression. I see that quite frequently. There's research over the past 5 years actually that's shown that this treatment does improve mood significantly, to the degree that they're recommending it as a treatment for depression, actually. And I can see that absolutely. A lot of people come in. I will tell people if they're depressed when they come in, I said, there's a good chance that you won't be depressed by the time you finished. And usually I'm right. The other thing is anxiety levels drop. And we talked about that earlier. One of the reasons for that is that insomnia causes anxiety and anxiety causes insomnia. And so when we improve the sleep, it improves the anxiety. When we improve the anxiety, it improves the sleep, which improves the anxiety, which improves, get the wheel spinning that way. And what happens is, and if you think about it, it makes sense. When people are tired and they're trying to go through their day, it's harder to manage things. And so you get more anxious or frustrated or irritated about things, right? And you're more anxious, you're more worried. So it really does improve anxiety in the majority of people. And I spoke to a doctor in my medical building about 3 years ago before the pandemic, who had referred over 100 people to me at that time. And she said that to me. She said, thank you very much. You've treated over 100 of my patients, and the majority of them don't have insomnia anymore. And I said, oh, my pleasure, because I really enjoy my work. And I said, thank you for the referrals. And what do you see when the patients come back to you? This is a family doctor. And she said, when I give them advice which will benefit their health, they have the energy and the motivation to implement it now. And so she was seeing health benefits and better life choices being made by people because they had the energy and they were rested.
Oh yeah, that's a huge part of it. Making any change. Because a lot of the clients that we see, they come in wanting to make some form of change, right? Whether it's getting more active, losing some weight, which requires change in their eating habits. And yeah, it's definitely a lot easier when you slept well and feel rested, and you know, you just make better decisions overall, right?
Absolutely. That's right. Yeah. So yeah, those are the sorts of outcomes, and we get over 90% success. I recently pulled out 100 charts at random, and I looked at the results at the end, and 53% of the people did not have insomnia at the end of the program, and another 43% were well on their way. Like the patient we just talked about, that would be a typical result in that 43%, where it's not quite normal yet. She's not quite getting enough sleep, but she's well on her way. Everything's moving in the right direction, and she'll get there. And so that adds up to 96% if you consider both of those successes. And so it's quite, people are quite happy at the end.
Yeah, that's amazing. And yeah, when my client was telling me about your program, that's one of the things that I liked about it, is that you give these patients the tools to keep improving when they leave, right? So it's not something like, you know, you're 100% necessary for them to see results or improve if they haven't gotten where they ultimately want to go by the end of your program.
Absolutely. And Vanya, when people thank me at the end, I always say to them, look, I do the easy part. I just tell you how to do it, and you're the one who has to implement. You're doing the hard part. So congratulate yourself as I am doing now. Good job. Nicely done.
Yeah, I say the exact same thing, you know. And like I just give you suggestions and tell you what to do, but you actually have to be the one to do that.
I watch people doing it and I'm amazed. They do this hard work, like sleep scheduling. One of the things we do is we shrink the amount of time that they spend in bed. The average person with insomnia is getting 5.5 hours of sleep, but they're in bed for 8.25 hours to achieve that, which is way too much time in bed. But they think if I'm in bed longer, I'll sleep more, but they don't. So we shrink it down to 6.5 hours. From 5.5 hours of sleep, we would shrink it to 6.5 hours. That's hard. We're getting them to go to bed later and up earlier often, or usually up at about the same time, but to bed much later often at the beginning. And I tell people this is hard, but it really works well. And sure enough, it shrinks the insomnia, but for the most part, people still sleep the same amount.
Mm-hmm.
And then we add time back gradually, and they get more sleep that way as we add the time back. Okay. But it's hard. It's hard to do. But so I watch these people doing it and I think, wow, you're really something.
Yeah. Oh yeah, exactly. Yeah. Yeah. And again, it's the same thing with my clients trying to make some sort of health behavior change. It's like the concept is simple and easy to understand, but actually doing it is quite difficult.
Exactly. Yeah. Yeah.
Mm-hmm.
And it's lovely to see people do it and they get the results, and then you get the professional satisfaction. Yeah,
yeah, for sure.
Yeah.
And yeah, back when you were talking about how sleep helps to improve, depression and mood, it just reminded me of a little story. Because I'm fortunate enough to be able to get good sleep, but my husband doesn't really sleep all that well. And I remember one day, I guess he got a good night's rest for once. And when he woke up, he turned to me and he goes, "Is this how you feel every day?" It was just amazed at how good he felt. And I was like, yeah, I think so. So yeah, it does make quite a big difference.
It does. It's huge. When you're rested compared to when you're fatigued from not enough sleep, it's enormously different. And
Mm-hmm.
people will say that to me in the last session. They'll say, this was life-changing. I often hear that,
Mm-hmm.
or, this is awesome how I feel now. Or I haven't slept like this since I was 10 or something. I'll hear that from some 70-year-old woman, right? That's finally gotten to sleep again. So
mm-hmm. Yeah, exactly. And one of my struggles is because sleep or lack of sleep is a big issue right now for a lot of people. And whenever I'm trying to talk to my clients about doing things to improve their sleep, sometimes I find that it's difficult for them to kind of like comprehend how much of an impact it can make in their day-to-day lives, right? Because when you've lived a certain way for so long and it becomes normal, it's hard to kind of like understand or imagine how much better it could be until you actually feel it.
Yes. Yeah. No, I agree with you, Vanya. People, and I will use that same idea with people, and I'll say, how do you feel now? Let's say Bob, and Bob will say, oh, I'm getting, this much more sleep. I feel really good. And I said, why don't we add 15 more minutes and see how you do until the next session? Oh, I don't know if I need that. And I said, I'm not sure what rest it is yet, okay? Because you've had your insomnia for so long. So that same idea. And sure enough, they'll come back the next way and they'll say, I can't believe it. It actually feels better,
Yeah.
So I say, why don't we go for another 15 and see what happens?
Right? Yeah, it's amazing. So hopefully, sharing stories like these help convince, a handful of people to even try just sleeping an extra 15 minutes, just to see how you feel.
Yeah,
it'd be life changing.
It could be. Yeah, might do the trick.
Yeah. So, Dr. Lynn, how did you get into this line of work in the first place and helping people sleep better?
Well, I started in general practice, and I found myself very interested in listening to people's emotional problems and issues. And so I did training in psychotherapy very early in my career. Mm-hmm. And then I started to do psychotherapy full time. And I worked mainly with post-traumatic stress as the main focus of my practice for many decades, actually. And then I decided that I needed to have a change and to do something else. And I was always interested in sleep. And so I'd read about cognitive behavioral therapy for insomnia and read that it had really good results and I could do it in a group. And I love to teach, and I've done a lot of group work in my years of doing psychotherapy. So I thought maybe that's a nice fit for me. So I tried it and I love it. I just love I just found that this is just perfect for me as a professional. It draws on a lot of things that I have a natural ability for. I love to teach, for example, and that's a big part of it. And also I was very pleasantly surprised by the types of results we were getting. It's just enormously gratifying as a professional. So I got into it and I found out I loved it, and here I am. And we ended up, at the beginning I was notifying all these doctors that I was doing this, and then all of a sudden the referrals were just flowing in. And so I was lying low for several years, sort of hiding, because we got a bit overwhelmed by how many people got referred to us. But now I have one other doctor who's working full time, Dr. Lepadatu. And then we've got another doctor, Dr. Marie-Claude Gagnon, who's just joining us right now as well. And there'll probably be more room for more doctors to be providing this as well as we go forward. And we call it the Insomnia Care Clinic now.
Oh, okay. Yeah. And where are you located in Ottawa?
So it's all virtual now. I do have an office at 595 Montreal Road, which is just off of Saint Laurent on Montreal Road. But all of it is done virtually now.
Oh, okay.
So, yeah, we started with that with the pandemic, but it's worked out and it's very convenient for everybody because they can, because the sessions are long, as I pointed out earlier. And
Right.
so people can, finish work and then just go on their computer and join the session right away. Right. So it works out well.
Oh, okay. Yeah, that's great.
Hmm.
Yeah. And if my work with my clients is any indication, I'm sure there's no shortage of people who will want your services. So it's great to hear that you're expanding and looking for more doctors to help you out.
Yeah, because people were waiting too long, in my opinion, to get the treatment. That's what was going on.
Yeah.
And so I was really happy to find Dr. Lepadatu, who wanted to do this, and then also Dr. Gagnon, who's going to be joining us. There you go.
Yeah, that's great. Yeah, and you mentioned earlier that, if people are seeking your help, all they need to do is go to their family doctor and get a referral.
Yes, that's right. And it should be what I call a full medical referral. So we want to know their medical conditions and their various medications and treatments, and just past medical history and family history, all that sort of stuff. If they send that to us, then we can do the intake interview and appointment and take it from there.
All right, great. And so before we end off, so maybe there's people who aren't necessarily suffering from insomnia and won't qualify for your program, but there are, lots of people who suffer from varying degrees of lack of sleep. So for these people, what would be your best piece of advice as to, something they can tangibly do tomorrow in order to get better sleep for themselves?
One thing that's again, it's hard for me to answer that question because it might be a scheduling problem that's the main issue. It might be anxiety. It might be negative thinking about their sleep, which needs to be cleared up. So I can't give sort of a generic piece of advice. But one thing that I didn't mention before is the exposure to blue light in the evening is turning out to be a big factor. And for some of my patients, it's a game changer to not expose themselves to blue light for the half hour to 2 hours before bedtime. And it turns out that blue light is emitted by our light bulbs, not just screens, and that the software that makes your screen go into night mode or whatever they call it, where it's dimmer and it's oranger, it doesn't work actually.
Oh, okay.
Yeah, so people think they're protecting themselves, but they've done research. What blue light does is it tells the brain that it's nighttime, and the brain continues to, it does not produce melatonin until it gets dark, all right? Right. We evolved under conditions where our only light was campfire light or candles, which is orange. It turns out that orange light doesn't have any blue light in it.
Okay.
And so we'd be sitting around the campfire before bed, and our brains would go, oh, it's nighttime, and start producing melatonin before bedtime. So the melatonin goes up before bed and makes people sleepy. And, or I should say it promotes sleep, because melatonin actually does a whole bunch of things in the sleep system. And then the melatonin rises nice and high in the middle of the night, and then it's leaving in the morning when you get up. So it promotes sleep at bedtime, sleep in the middle of the night, and then wakefulness in the morning because it's leaving. Most people are exposed to tons of light from their house lights and also from our screens, of course. And so people look at me and I say, you're thinking I'm going to say you can't look at your screens, aren't you? Right now. And people are looking worried, right? And I say, look, I've got another solution. And gosh, I don't have them here, but there's some orange safety glasses that you can wear that fit over glasses, or just if you don't wear glasses, that you can wear in the evening. They're pumpkin orange. They're really deep orange.
Yeah.
And if you wear those for 2 hours, half an hour to 2 hours before bed, you can look at your screens. You can have all the lights on. And the research shows that when they give these to people with insomnia, their sleep improves that very night.
Right. Oh, wow.
Yeah. They can't be clear. They have to be orange.
The orange. Oh, okay.
Yeah. And some people are big responders to this. They tell me it makes a difference, a big difference right away. And so for some people, it'll make a huge difference right away. It'll shrink their insomnia, and they'll also feel better in the morning because their melatonin, instead of being delayed at the beginning of the night and then delayed in leaving in the morning, which makes them groggy, the melatonin will be leaving in the morning as well. And they'll feel better in the morning. So it can be a big game changer for some people.
Yeah. All right. Great. So pumpkin orange glasses.
Yeah, pumpkin orange. That's the color. All right.
All right. Yeah. Well, thanks again for speaking with me, Dr. Lynn. This was, definitely really informative. You know, I'm sure there's so much more that you could talk about, but I want to be mindful of your time. But maybe if there's interest, we could have you back on for another episode. I'm sure there'll be tons of questions.
All right. Well, thank you very much, Vanya. I've enjoyed my time with you. You asked some very good questions, and I appreciate if we can help some more people. That's my goal here, to help as many people as we can. So I appreciate this.